Ali Velshi, a great journalist, was doing this a long time, myth busting. I mean, while everybody else was buying the Kool-Aid, while everybody else was allowing the right to hold a narrative on healthcare, he was there myth busting. There just wasn't enough of him going around to do it. Well, you know, Republicans are back in power, in the House, that is, and their expectation is that they start with the House and next election they'll get the Senate and the presidency. It's important for us to know the reality, though. We need to know where we've been, where we are, and where we're going with respect to everything, but specifically in this case, healthcare. And you know what? All that he said in this piece still holds true. Are there solutions? Of course, we'll talk about that after, but check this out. This was a hell of a report by Ali Velshi. Check it out. We'll take it on the other side.
Keep on drilling down on some of these big myths that are being spouted about healthcare surrounding the healthcare system here in the United States. And one of the myths we hear, we've had it said on this show several times, is that the United States has the best healthcare system in the world. So I want to look at U.S. performance rankings from 2013. You can, by the way, go on the internet. You can find lots of these various ones. This is the Commonwealth Fund. They used OECD data, developed countries, and they ranked 11 countries. Look at this. Out of the 11 countries, the United States is ranked 5th out of 11 in terms of quality of care, 9th out of 11 in terms of access to care, because so many millions of Americans don't have access to care. 11, the last place, dead last in terms of equity. If you are an insured American, you are the best in the world in terms of what you can get. If you are an uninsured American and you're poor, you're done for. In terms of healthy lives, and I'll get to this in a bit, dead last. And in terms of efficiency of delivery of healthcare, America, out of 11 developed countries, dead last once again. That's OECD data. Same data set looking at overall rankings of healthcare system outcomes. And I'll tell you what that means in a second. It's overall healthcare, longevity, disease prevention, things like that. Britain is number 1. Switzerland, which actually spends a good amount of money on healthcare, is number 2. Sweden is number 3. You go all the way down the list. Guess who's in dead last place? Once again, the United States. There's a kind of a reason why all these people from all these countries aren't actually rushing to get into the United States for healthcare. Life expectancy. That is the most comprehensive health outcome there is. Canada, where all those millions of people are apparently rushing to get health care in the United States, has the highest life expectancy of the bunch, 80.7. There are some countries higher than that, actually, but 80.7. The average of all developed countries is 79.3 years in life expectancy. The United States, bringing up the rear again, 78.8. Now, I will say one thing. I put this asterisk because I think it's important. Car crashes and gun-related deaths are disproportionate in the United States. That does have a bearing on this. So U.S. Life expectancy is not simply lower because of a healthcare system. It's because a lot of people die from gun deaths and car crashes. Okay, let's talk about spending per person. Spending per capita is the best way to measure spending in healthcare. The average spent in developed countries around the world per year, $3,814 per person. In the United States, $9,451. So we spend more than double what everyone else in the developed world does on healthcare, and our outcomes and our life expectancy is actually lower. These are the numbers. Whenever I say that everybody else gets better value for their healthcare dollar than Americans do, this is what I am talking about. I'll keep going on these myths because there are a lot of them to buy.
Now, that is where healthcare stood then. And guess what? It is still in that realm, if not a bit worse now, which means we've arrested the path to hell, but we didn't arrest the path going to hell. So there are solutions. Healthcare for all. A single payer system. Learn about it. We talk a lot about it in many of our videos. We give webinars on it every so often just to inform. So please, let's make sure and not allow the misinformation, the disinformation, the lies to really cauterize in our minds. Let's understand how things really are. And let's go ahead and elect people who will bring the single payer system in healthcare the ones that will save us all a whole lot of money and give us healthcare. You saw the discrepancy in price. You saw the discrepancy in longevity. You saw the discrepancy in efficiency. We can do it. We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number one, subscribe to our channel. And number two, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.